Each year in America, thousands of men die simply from embarrassment when suffering from prostate problems. Prostate cancer is the second most commonly diagnosed cancer in men and the second leading cause of cancer death in men. And every man over the age of 45 is at risk. Here to talk about prostate cancer, the importance of early detection, and the latest treatment options is Dr. Davinder Sekhon, a board-certified urologist at the Woodlands Center for Specialized Medicine. Thanks for being here.
Thank you very much for having us.
Well, why men 45 and older? Let's start there.
Well, prostate cancer is a disease process that usually affects older men. So men that are younger are usually not screened for cancer. They usually don't have cancer, although in some cases they can. But like other things in life, prostate cancer is more common as people get older.
Well, what are some of the symptoms?
With current detection, there really aren't a whole lot of symptoms. We have initiated prostate cancer screening, and we screen basically all men over the age of 50 and 40 in some cases. And these men often will not have any symptoms at all when they're diagnosed with prostate cancer. Now, some patients that don't undergo screening will have symptoms, and symptoms can vary from anything like urinary frequency, blood in the urine. Men with advanced cancer can have pain in their bones, but usually if there are any symptoms at all, it'll be urinary symptoms such as frequent urination or blood in the urine.
Well, in addition to just age, are there any risk factors that make someone more susceptible than others, maybe?
There are 4 things that are commonly accepted to be risk factors for prostate cancer. The first is age, which we've already discussed. The second would be race. So men who are African American are more likely to get prostate cancer. The third is family history. Anyone with a first-degree relative with prostate cancer, father, son, brother, they're more likely to get the cancer. And those 3 things are not controllable. The fourth thing that's associated with prostate cancer is a high-fat, low-fiber diet. So people that consume a high-fat, low-fiber diet are at increased risk of prostate cancer, and that's really the only thing that can be modified by a person if they're trying to reduce their risk.
So tell us a little bit about the screening, and so you're recommending this, and how frequently you recommend this.
Prostate cancer screening is generally recommended in any man over the age of 50. Starting at age 50, we do a digital rectal examination, which is a physical exam of the prostate. We do a PSA, which is a blood test that is a screening test for prostate cancer. Now, in some cases, we do start the screening process earlier. Men who are 40 years of old and have a family history of prostate cancer, or men who are African American, will begin getting their screening at age 40.
Okay, well, is there anything that can be done to prevent it?
The only things that we really think of are eating a healthy diet,
Right.
And then also there's been some recent studies to suggest that some of the medications, finasteride or dutasteride, may in fact reduce the chance of getting prostate cancer, but those are currently being studied. There's nothing proven, and it may take several years before we have anything definitive on that.
Okay, so really you're saying early detection is key to dealing with the situation.
As with any cancer, early detection is key, and really when we detect the cancer early, which we usually do nowadays, we are able to treat the patients. They usually do very well.
Was this something that someone should bring up to their doctor and talk about, or was the doctor really going to take the initiative and say, okay, you're approaching this age and you have these risk factors, here's what we need to do?
In my experience, the family physician usually brings this up. It's screening as with any other type of cancer, breast cancer, colon cancer, and the physician usually initiates the conversation. In some cases, the patients will initiate it, particularly if they're very concerned about getting prostate cancer. If they have a strong family history of prostate cancer, they might bring it up on their own, and usually physicians are very receptive to that.
Well, let's say unfortunately there's a fortunate situation someone does have it. Tell us a little bit about treatment options. I know there's been a lot of changes and they're not quite as scary as maybe they used to be. Tell us a little bit about the latest in treatment, if you don't mind, please.
Yeah, prostate cancer, when it's diagnosed, there are a variety of treatment options, ranging anywhere from active surveillance, which we just monitor the cancer closely. We get a PSA, do an exam once every 3 months, and then we'll restage the cancer with a repeat biopsy a year after the diagnosis. Another treatment option would be radiation therapy. Radiation therapy is commonly used for the treatment of prostate cancer and is a good option, particularly in men who are not candidates for surgery. Surgery is a great option for prostate cancer, particularly in younger, healthier men. They typically do very well with the surgery. And then one of the newest types of surgeries we have is called a Da Vinci robotic prostatectomy, where the prostate is actually removed through small incisions and does make an impact on the patients, particularly in the recovery. It's a faster recovery time, less time in the hospital, and some other advantages associated with that. But that's one of the newer things, something we're very excited about in treatment of prostate cancer.
What kind of feedback have you gotten from patients who have used that method?
The majority of the patients that have had that method have done very, very well. And you can tell a difference in the patients we used to do the open way versus the ones that we're doing robotically now. They're back to their normal activities quicker. They have a lot less pain associated with the procedure, and they're out of the hospital quicker, which for most people is a big bonus to get back to their home.
Big plus. Well, we talked about earlier that this really is a very serious problem for men, but if it's detected early and these treatment methods are followed, how successful is actually treating it and avoiding the death?
Very successful. Yeah, a lot of the conversations I have with patients is, okay, we've diagnosed you with prostate cancer, now what are we going to do? And some of them are very upset with the diagnosis, but as long as it's found early and treated early, the prognosis is very good going forward. And most men will live 10, 15 years after being diagnosed, after treatment, and then beyond that even.
So does it really just totally erase the situation, or is it something that could come back again?
In most cases, treatment is cure for the cancer.
Great.
But we do have to keep an eye on it. We check a PSA, check an exam every 6 months to every year, depending on the type of treatment we've used. But in most cases, it doesn't come back if it's caught early.
Do you find that this is a conversation that a lot of men just don't want to have?
Yeah. A lot of men don't want to have it. Their wives want them to have it. So they end up having it one way or another. But it's a difficult thing to bring up. And a lot of people aren't real fond of the examination, which is understandable. Right. But it's a very, very treatable cause of cancer death in the United States with proper screening and treatment.
Great. Well, where can our viewers get more information if they want to do a little research on their own or talk with you, for example?
There are several books that are available. The internet is a great resource, as it is for a lot of things, but there can be a lot of misinformation on there. A lot of times I'll recommend to the patients that they visit the Mayo Clinic website or the National Cancer Institute website. They're very helpful. And then in terms of local options, we're located on Davis Highway over there at Woodlands Medical Specialists, and we're happy to talk with anyone about screening of prostate cancer and also treatment of prostate cancer. Like you said in the open, 1 in 6 men in the United States will get prostate cancer, so it's very, very common, and we're very experienced with treating that.
Great. Well, appreciate you being here.
Okay, thanks a lot.
Thank you very much.